From smallpox to polio and now COVID-19, vaccines have saved millions of lives, improving the health of everyone everywhere. However, after so many decades, there is still mistrust about the role of vaccines in preventing diseases. That is our focus today on Soundhealth. I am Olasunbo Mudupe. Welcome to the show. You'll get to meet my resource person shortly after COVID-19 updates.
The World Health Organization has listed the Sinopharm COVID-19 vaccine for emergency use, giving the green light for this vaccine to be rolled out globally. The Sinopharm vaccine is produced by Beijing Bio Institute of Biological Products Co. Limited, subsidiary of China National Biotech Group. WHO Assistant Director General for Access to Health Products, Dr. Mariangela Simao, says the addition of this vaccine has the potential to rapidly accelerate COVID-19 vaccine access for countries seeking to protect health workers and populations at risk. WHO urges the manufacturer to participate in the COVAX facility and contribute to the goal of more equitable vaccine distribution. The Sinopharm product is an inactivated vaccine called SARS-CoV-2 vaccine Verocell. Its easy storage requirements makes it highly suitable for low-resource settings. It is the first vaccine that will carry a vaccine vial monitor, a small sticker on the vaccine vials that changes color as the vaccine is exposed to heat, letting health workers know whether the vaccine can still be safely used. On the basis of all available evidence, WHO recommends the vaccine for adults 18 years and older in a 2-dose schedule with a spacing of 3 to 4 weeks. Vaccine efficacy of symptomatic and hospitalized disease was estimated to be 79% all age groups combined. The WHO has also launched the hashtag Together for India appeal to raise funds to support WHO's work in India, including the purchase of oxygen, personal protective equipment, and medicines. To donate, the public are advised to go to http://who.foundation. Click the donate button and select the hashtag Together for India appeal. The federal government has shut down bars, nightclubs, and recreational centers in a bid to curb the spread of the coronavirus in the country. The government also reintroduced COVID-19 restrictions across all 36 states and the Federal Capital Territory. The head of Technical Secretariat of the Presidential Steering Committee on COVID-19, Dr. Mukhtar Mohammed, said the new directive takes effect by midnight of Tuesday. He said the bars and nightclubs should remain closed until further notice. While stating that there was no limitation to interstate travel, he advised that only essential international travels should be embarked upon, with all existing protocols strictly adhered to. In Nigeria, over 165,000 cases, above 156,000 discharges, and 2,065 deaths have been reported. Globally, there have been over 159 confirmed cases of COVID-19, including 3.5 million deaths reported to WHO. A total of 1.29 billion vaccine doses have been administered.
It's still Soundhealth on Lagos Television. My resource person is Dr. Blossom Madrofoka, a public health physician and the public relations officer for the Association of Public Health Physicians of Nigeria, Lagos State Chapter. Welcome to the program, Dr. Madrofoka.
Thank you so much for having me. Good afternoon.
Good afternoon. Why are vaccines important and how do they bring us closer?
Okay, so before I get to that question, the first thing we need to to answer is the first question we need to answer is what are vaccines exactly? Because people need to understand what vaccines are exactly. So vaccines are they're substances that are injected into the body, and the purpose of these vaccines is to stimulate or basically to teach your immune cells, what we call the soldiers of the body, the immune cells that help to protect you against disease. It's basically to teach, to train your immune cells to fight against disease. So when you get the vaccine is usually like a mild form of, let's say, the organism that causes a particular disease or a part of that particular organism. So your body is introduced to this organism. Now your immune cells have the time to develop specific cells to these substances. So that when your body encounters the real infection, your body is ready, your immune cells are ready and primed to fight that infection, so that the individual actually ends up not coming down with the disease, and the individual can be protected from illness, the individual can be protected from disability, the individual can be protected from even death. So vaccines save lives, and the beauty of vaccines is when one person is vaccinated, you protect the person next.
For decades, vaccines have saved many from deadly diseases. It is sad that at this time there are lots of misinformation about vaccines. What does it take to develop a vaccines now?
Okay, so that's a very good question, Shumbo. To develop a vaccine, it also helps when the public understands the process of vaccine development, so that the public can understand that it's a very rigorous and painstaking process, because we want people to stay safe. We don't want to endanger the health of people.
Okay.
So before a vaccine is developed, there's something we call the exploratory phase. So you're basically in the lab trying to test out different substances to determine if they can actually stimulate an immune response. So when that is successful, we go to what we call the preclinical phase. The preclinical phase is where you test it on animals, on mammals, to see if you can stimulate an immune response in those non-human subjects. So after that is successful, now you go to the clinical phase of vaccine development. So the clinical phase has three main phases: phases 1, 2, and 3. We even have a phase 4, which I'm going to explain. So the phase 1, we're testing the vaccine on just a few people, just maybe a dozen people. And we want to see, is this vaccine safe? Also, we want to see, can this vaccine stimulate an immune response? So after that is successful, then we move to the next phase where we're testing it on hundreds of people, like about 100 people. And we're trying to, first of all, we're trying to still see, is it safe? And second of all, we want to see, does it really work? And does it work differently in different groups of people? And then the third phase is the phase where we test on tens of thousands of people. We all saw this during the development of the COVID-19 vaccines. When the companies got to the third phase, they made the announcement, oh, we're testing on 40,000 people. So at this point, we want to see, is this vaccine efficacious and is this vaccine safe? What are the adverse events that can occur with this vaccine? And is there any way to record these adverse events? So after the third phase, that's when you go for approval. So the companies go for approval based on the data they have from the first 3 phases. And when it's approved, then it's rolled out to be used in the real world. So now, as it's being rolled out in the real world, it's still being tested. We're still gathering data. At this point, we want to see how effective the vaccine is. And that's what was done in places like Israel. Israel actually tested the effectiveness of the Pfizer vaccine and found out that it was equally effective in real life situations. So these are the phases of vaccine development.
We all know that these vaccines have been used for emergency purposes. Now, what next after the emergency authorization use?
Okay, so emergency authorization use is a situation where you approve the use of a vaccine, drug, because you realize that the risk of not introducing that intervention could cost lives. So what happens is when you give an event, like in the COVID-19 vaccines and even some interventions that were introduced for the COVID-19, we found that we had to give these emergency authorizations because we found out that the risk of not providing these interventions that could possibly save lives was too great because people were dying of COVID-19. So that's a situation where emergency authorizations are given.
So what next after this? After the emergency authorization use?
So after the emergency authorization, so like the example I gave with Israel, so after the emergency authorization, data is still being collected. So we know that in Israel, they found that even after the introduction of the vaccine to the general public, they found out that the vaccine was up to 90% effective in the real world. So now that we have found out that it's been effective, and as this is happening, we're recording any adverse events that are observed. So if, for example, you discover there's an adverse event that is the risk of introducing the vaccine is too great, then you withdraw that emergency authorization. So two things can happen. Either you withdraw that authorization or you give a full approval. In which case, in the case of the vaccines, we have seen that the adverse events have been very minimal and the benefits for the vaccine have been too great. So what happens is a full approval is given for that particular vaccine, drug, or product.
All right, immunization is beginning to pick up after disruption due to the pandemic, although there are issues of hesitancy and inequities. What must be done to overcome these challenges now? Especially
You asked a
now,
very
especially
great
now that we
question.
also have the issue of vaccine nationalism.
You asked a very great question because we know that in the past 1 year, in fact, in the past 1 year, information on vaccines, both positive and negative, we've had so much information and a lot of vaccine hesitancy has been built. So the key to overcoming these challenges is communication.
Okay.
So we need to communicate with the public. We communicate with their leaders. For example, you go to a community. You're not going to come as, oh, I'm the professional, I know everything, and I'm going to tell you what to do. No. You go to their leaders, people that they trust. Because we have seen one thing with vaccine hesitancy, there's a lot of mistrust. In Nigeria, people mistrust the government, people mistrust countries in the West, or they want to eliminate the Africans. I mean, infodemics, we've seen everything on social media. So we need to come to people where they are and begin to provide information through their own leaders, and information that is culturally acceptable to them, information that they can actually identify with. So we don't want to speak at them. We want to work with them to see the need to accept vaccines as a way to save lives.
Yes, the World Health Organization and key players are already being proactive. Now, let me ask you, Dr. Madofoka, how will the WHO's new immunization agenda 2030 framework for action chart a path to equitable immunization coverage for everyone?
So the big question we've always had with vaccinations was equity. Because let's use COVID-19 vaccine for it, okay? The vaccine is not affordable to many countries. So, and we talk about herd immunity. So, how are you going to have herd immunity when it's only the rich countries that can get their citizens vaccinated? So, vaccine equity is key because when one individual is not vaccinated, one country does not have herd immunity, our job is not done. So, to one of the steps or one of the initiatives that the World Health Organization and a group of non-governmental organizations have actually embarked upon was the COVAX initiative. And that was very, very, very key in ensuring that at least 20% of low income countries, 20% of the populations are able to get vaccinated. And it's initiatives like this that that we want to see somehow bring some level of equity in vaccinations. But the truth of the matter is, Israel is the population is almost fully vaccinated, but they're going to get pilgrims coming from Africa, coming from all these nations where people are not fully vaccinated. Then what happens? So equity is key, and the COVAX initiative is one way that we can achieve that. But I believe that we need to do more.
Locally now, what will it take to make the agenda a reality in the next 10 years?
So to make the agenda a reality, there are several levels that we need to approach. We need to approach the individual level, the community level, the local level, the state level, and at the national level. At the community level, like I already said, we need community mobilization and community participation. We need the communities to own these vaccine programs. At the local level, I remember when I worked with a certain local government area. We will go out in the morning with loudspeakers inviting people to get vaccinated. And it actually works. People that can't watch, for example, they can't watch this TV show as we're having this discussion. But you walk out on the street with your loudspeaker and invite people for immunizations, and people actually show up. So that's one thing we can do at the local level. At the state level, we need to the local government areas. We need to empower the PHCs. We need to empower the general hospitals. We need to equip these facilities with enough vaccines, enough information material to draw individuals to get vaccinated. And at the national level, we need to have strong policies that we actually follow through. We're not going to have policies with one administration and then with the next administration we have another policy and we don't follow through. So we need to have policies that we actually follow through for the next 10 years, just like you said.
All right, Dr. Madofoka, we have to drop the conversation here. I'm hopeful that soon we will achieve equitable immunization coverage for everyone. Thank you for your insights always.
Thank you so much for having me. Have a great day.
You too. I have been speaking with Dr. Madofoka on the role of vaccines in preventing disease and how to achieve equity distribution. Dr. Blossom Madofoka is a public health physician and the Public Relations Officer for the Association of Public Health Physicians of Nigeria, Lagos State Chapter. Soundhealth continues with trending health reports. Please stay tuned. It is still Sound Health on Lagos Television. This is all we have time for this week. Be safe always. Wash your hands for at least 20 seconds with sanitizer or soap and water. Wear your mask and avoid social and large gatherings. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.